Goa Medical College, he was treated appropriately. I have a neurosurgeon with me who operated him, and his head injury was quite severe, and his score was 5, GCS score. So when score is 5, sometimes it becomes very difficult for a person to survive. But we did our best. He was in intensive care unit for almost 5 to 6 days, managed by our intensivist, and all ventilatory support was given. The patient is a native of Kerala, and we also were trying our best because of his age. He should be put to action, or he should survive. Not to our he had a brain dead very early after 6 days. The first apnea test came positive, and then our apnea brain dead certification committee under Dr. Sanat Bhatkar, who is a neurologist, we conducted the first apnea test, and they found that patient had a signs of brain dead. Again, he was kept on ventilator to see if things improve, but he did not improve, and the second apnea test also became positive. At this time, we felt that being a young patient, he could donate his organs for the benefit of patients who are on our Goa wait list for kidneys, and other organs we had put on ROTO, that is regional tissue transplant, and there was a recipient at for the liver outside Goa, that is Aurangabad. So this organ was taken to Aurangabad as per the ROTO, classification, as per the ROTO priority, whereas the two kidneys came to Goa Medical College for those two patients on the wait list. One of our recipient is just 24 years old. The second recipient is 39 years old. And both these patients were waiting for kidney because they are on dialysis and they are very sick patients. So today they will be taken. The first transplant is on, and after this, second transplant will be done. Now, what is important here and why we are gathered here? So we want to actually felicitate and appreciate the uh, members of the family who took this bold decision of donating organs. When somebody is very sick in the family and somebody is on deathbed, sometimes we are so much covered with the grief, it becomes very difficult. In fact, we also feel how they get a daring to say yes, we are donating organs, and this has happened in 2025 for the third time. This is our third donor in this year. So we have already got uh, you know uh, 11 lives saved in 2025. Correct. So it has been a kind gesture on behalf of the family members. I have family members sitting here. He is the person. He also works in MOPA. You would like to say something on this? How you felt like giving?
I'm very proud of this guy. We are like giving his life for the child who were having suffering from this kidney failure and all. I thanks to this GMC for providing this kind of support for us till date, and we are expecting future support to transport his body to Kochi.
Yes.
That's all from my side.
You would like to say something? So I have a neurosurgeon who will just give us a brief as to how the injury was so severe.
It was a very severe head injury. Brain was edematous, and there was a collection of blood also in the subdural space on the right side. Surgery was done. He came to GMC. We did what we call a decompressive heavy drainage, so that we create space for the expanding brain, edematous brain. We keep it in a subcutaneous pouch in the bone. We did all this to create space, but unfortunately, because the injury was very severe, he deteriorated gradually over 6 to 7 days in the ICU. And scan also showed a lot of edema. And then gradually his disease became 3 by 50. It was a very severe thing, not much. Tried whatever we could, but ultimately succumbed to his injuries.
After the surgery, patient was kept under intensive care unit, and we have a intensivist doctor who will tell us about how was his post-operative care.
The patient was on ventilator for almost 6 days, and his conscious level, the score as such, there was no right to breathing, but he still had some breathing efforts. We still had some hopes initially that he might survive. But towards the end of 6 days, almost on the seventh day, he showed signs of all signs of brain death. So that is the time when we informed the SOTTO, and that's how the process started.
Many times this concept of brain dead खूप लोकांक खबर ना ब्रेन डेड म्हणजे कितें अशें कळना लोकांक की जेन्ना हार्ट इज पंपिंग लोकांक दिसता पेशंट जाय पण जो हार्ट डेथ बाय कार्डियक डेथ म्हणटा आमी तो जावचे पयलीं मनशाक ब्रेन डेड जाता आनी ऑर्गन्स आर टू बी डोनेटेड ड्युरींग दॅट पिरियड बिकॉज एकदा जर हार्ट स्टॉप जालें जाल्यार there is no way that one can use these organs for the benefit of other patients. So this we have an official committee which goes and sees about the brain death certification. And in the whole process is actually we we try our best to save lives on this, especially in a severe head injury patients. The department of neurosurgery is on very high level treatment. But अशें जाता एक फावटी की we are not able to save patients and these people are brave enough. The donor is brave enough to donate his organs. Now today on behalf of SOTO, we wanted to thank the family of the donor and also give a word of appreciation as the family member said that we are going to do his transportation of body and a dignified funeral. He will be sent to Kerala. He is from Kerala, so that part will be taken care by War Medical College, and the whole logistics will be seen by the office of the dean. This is what we have decided. So we would like to, in your presence, felicitate the family members of the donor and appreciate the great thought that you people came forward. And then let us say a big thank you to the heroes of this. Thank you.
The second case during Mopa airport, and this is the incident. Partly, but it is
No. That was not. One was at bus stop in Maksa, the first case, which was hit by accidentally. The father was hit, he was waiting at the bus stop with his 2-year-old child and wife. He was hit by Kadamba and then he had a very severe head injury. Again, the same thing. He was brought, he was treated here and to our bad luck, he succumbed to the injuries and he became brain dead. In that patient, all organs were utilized. Means he was just 25-year-old, and then our honorable health minister has promised to take care of the education of that 2-year-old child. And he has already promised that through his his own CSR, he is going to do it. The second case was the staff of Manipur. Oh, he did not meet an accident. He had internal bleeding. He was a little older. His name was Ajay Giri. So his kidneys were utilized. And what else? Lungs were not. And liver. Again, kidneys and liver. The lungs and heart, so there was not utilized basically because these organs were not suitable for transplant. transplant. And this case is from Mopa, and he's also only liver and kidneys. There were no heart and lung couldn't be utilized for the donors or recipients.
So this Ajay Giri, how old was he?
Ajay Giri was 47 years old. He was a staff of Manipal Hospital. And this brain death certification was done by Manipal Hospital. And they reported to SOTTO first.
So his organs were used by GMC.
According to the rules, one kidney went to private hospital, that is Healthway, and the one kidney came to Goa Medical College.
And the
Liver went outside, I think Chennai, Indore. Sorry.
And in this case, what is the name of the patient?
Name we
Sahil VS.
Sign?
Sahil VS.
Only sign?
Yeah.
Or sign?
Sahil VS.
How old was he, sir?
22
22 years.
22 years old.
And when did he make this surgery?
28th of January.
Accident alone.
Excellent. What's it? Vehicle race.
And he was declared brain dead yesterday.
Yeah.
तो अनायासी कितने पेशेंट कितने वेटिंग लिस्ट में आए हैं
Now almost 6 are covered in this month of May. Means beginning of 6 patients have received kidney. I think another 20, 48 are waiting list. It's big number. Most of our patients who are waiting for kidney, they are diabetic nephropathy, and they are on regular dialysis. It really changes their life and they get an organ because there are not many live donors. Kidney, if you don't get a disease donor, you can at least have a live donor. Live donors have to be within family, but there are no live donors because the matching of the organs again is a big issue.
त्याची हाईट झाले का काम झालं
याचे ऑपरेशन 28 तारीख झालं आणि याला हेड इंजुरी आणि ब्रेन डेड काल झालं.
Thank you, sir.
थँक्यू.